So the first topic, which is of great importance for now and for the future, is the role of uric acid in cardiovascular disease. This is something which is going to grow very fast because the discovery of uric acid has been given us the opportunity to understand one of the important aspects of cardiovascular disease and the risk factor for cardiovascular disease. Very recently, a lot of studies have clearly demonstrated that hyperuricemia is associated with a significant increase in the rate of the major cardiovascular disease, as the reason for that is probably the fact that in the production of uric acid there is a significant increase in the oxidative stress, and this increase in oxidative stress is responsible for cardiovascular disease and for the induction of the atherosclerotic disease. Very recently, some trials have demonstrated the possibility to reduce the cardiovascular risk by reducing the level of uric acid with drugs interacting with the xanthine oxidase, which is the enzyme responsible for the uric acid production. And we have a hope that in the future, new drugs, and in particular febuxostat, which is a selective inhibitor of the xanthine oxidase, will be very useful not only for the reduction of the plasma level of uric acid, but also for the prevention of cardiovascular disease. This probably would give us the opportunity to reduce the residual risk, which is something that still affects the overall population beyond the intervention of the traditional risk factors. Today has been dedicated first of all to the review of the data of the combination of lercanin and enalapril in terms of antihypertensive effect and cardiovascular protection, and later on to the review of the data about the use of zafenopril in patients with coronary artery disease. As far as the problem of lercanidipine plus enalapril, this is a very useful combination which is pretty in line with what is suggested by the European and the American guidelines in terms of treatment of hypertension with drug combination. Most of the patients usually are not achieving satisfactory blood pressure control, and this can be done by using the combination of drug, and among the combination, those with ACE inhibitors and calcium channel blockers seems to be very effective. Among that kind of combination, the combination of lercanidipine and enalapril has emerged as one of the most effective in terms not only of improvement of blood pressure control, but also in terms of target organ protection, and all of this was associated with an improvement in the individual tolerability, which is responsible probably for the greater persistence of treatment and the impact on the prevention of cardiovascular disease. So I think a very good perspective for the future. As far as the zafenopril and the acute myocardial infarction and coronary artery disease, even in this field we have some new data that seems to suggest not only that zafenopril is working in this patient, but also that it seems to be pretty much superior to, and when compared to any other ACE inhibitors. This is because of the mechanism of action of zafenopril, which is not only the blockade of angiotensin converting enzyme, but is also associated with some additional properties, in particular some kind of antioxidant effect due to the structure of the drug that can have some protective and cardioprotective effect beyond the ACE inhibition. So the meeting was full of new information, and I think the most important was that we have new drugs that can give us more effectiveness in terms of prevention of cardiovascular disease. This is a good news for us as a doctor, and this is a good news also for our patients.